Show, and I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes. And our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And we're so excited to have with us Dr. John Lyons. Thank you so much for joining us again.
Thank you for having me.
We love it when you come. We always learn something wonderful from you.
So Dr. Lyons is a surgeon and skin and soft tissue multidisciplinary team chairperson. And so we're talking about, because May is Melanoma and Skin Cancer Awareness Month, and we know that we're going to be getting out in the sun soon. Hopefully we're not going to have as many of these rainy days.
That's right.
It's going to be sunny, and folks are getting ready to go outside. So let's talk about the threat of skin cancer when it comes to sun exposure. Everybody does kind of associate that and have heard it, but what do they need to know?
Well, you know, UV light is the major modifiable risk factor that we have for skin cancer. I mean, you can't change your DNA, you can't change the skin type that you've inherited, but you can typically affect the amount of UV radiation that you get, and UV radiation is a major contributor to skin cancer. So that's really the take-home message. I mean, if you can modify something, we should try to modify it, and that would be what you can modify.
Right. Well, let's talk about some of those safety tips. You know, when people do go outside, we've always heard, you know, different things about the whatever type of SPF you need, or, you know, what is the skinny young when they do go outside, taking precautions to reduce their risk?
Yeah, I mean, it doesn't take a lot. You know, we do recommend wide brim hats, long clothing. They're lightweight, long clothing that are appropriate to wear in the warmer months. Liberal use of sunscreen, SPF of 30 or greater, and sunglasses, and you know, try to avoid the peak hours of the sun. Now, I know realistically that's a challenge in Louisiana, but
right.
Try to seek shade, try not to overexpose yourself when unnecessary. Those are really the steps to take. Be cognizant of your exposure and the cumulative exposure. And then when we talk about application of sunscreen, you know, we want a good amount. I typically still recommend the old school cream, you know, rather than the spray.
Rather than spraying it.
Yeah, the spray's hard to quantify, and you know, the cream has been tested. Typically, creams that have you know, zinc or titanium are good barrier mechanisms. Yeah.
And then the fact that you need to probably reapply after going into the water. I mean, people go out, they put it on, then they're in at the beach or they're in the pool, and they never reapply.
That's right.
I think that's...
Yeah, no, it's significant. No, reapplication is important as well. That's a good point, right? If you're going to be for a long period of time, at least every hour to 90 minutes, yes, you should reapply.
Which is not something that, you know,
most people do.
We think about. And I think a lot of people
most people
don't think, I mean, people don't think about the sunglasses as far as protecting their eyes from risk. They just think about it as glare and, oh, I don't need sunglasses, but it's really important for reducing their risk as well.
Sure, it is. Yeah, it protects, you know, the eyelids and the mask areas of the face, and also, you know, polarized sunglasses can reduce the risk of cataracts as well. So yeah, it serves multiple purposes.
Right.
And they look cool, you know. So that's the other.
And they
thing.
look cool.
And you want
There's
to look
such
cool.
variety.
Absolutely. For sure.
So that's
and
the
I
other
don't know
reason.
if long shirts are in. Hey, just
That's right.
Well, the
Yeah,
beach
you
or
have
the
to-
backyard. I mean, you could be just walking and need to kind of protect yourself. You know,
Absolutely.
not realize.
You know, and even when you're like driving in your car, I mean, people will frequently get, you know, the
left arm tan.
the left
Correct.
arm tan, you
That's
know,
right.
the side
That's
of
a
the
truck
face
driver's tan.
You know,
That's right.
you think
That's
about
right.
all those things that you need to do, but you know, we said it was Melanoma and Skin Cancer Awareness Month, and we know that melanoma is at the top of your list of worst skin cancers, and so and everything early detection is part of making people have a better survival rate. So what, you know, if somebody says, you know, I've been out in the sun a lot, and like, you know, what do I need to look for if I have a spot come up that might be concerning for me to go have my doctor look at?
Sure. Yeah, I mean, they're the classic A, B, C, D, E's of melanoma, right? So, and that's been around for a long time. It hasn't changed, but that's the classic A, B, C, D. So I'll go through those. If you have a mole, and that mole is asymmetric, okay? You take half of it, the one side looks different than the other side, that's asymmetry, that's concerning. B is border irregularity. If the borders look scalloped or irregular, that's concerning. C is color. So a typical brown nevus or mole maybe doesn't look that innocuous, but if you see changes, purple and brown and red and yellow in this mole, that's concerning. Diameter, D is diameter, greater than 6 millimeters or a quarter of an inch, that's concerning.
Or I think I've heard them say, the end of the pencil eraser
That's right.
head,
Yes,
it's
that's
bigger
right.
than that.
That's exactly
just for
right.
getting, those apple oranges in your head.
To quantify that, that's right. About that's right. A pencil eraser is a good size. And then E stands for evolving, and evolving just means it's a changing. So I see folks who have had maybe a mole, in one particular location for 25 years, and it's never done anything, and then recently it changes. It starts to grow, or it starts to bleed, or it starts to itch, or it takes on some different morphology. That's concerning, and that should be any of those things should trigger an evaluation to your family doctor or to a dermatologist.
Right, and of course you can go see your family doctor, your general practitioner, and tell them about that, and then they can make that referral
Correct.
to the dermatologist or whatever if it needs to be biopsied and evaluated to further look at that.
Well, it seems like your family members are key because there's parts of our bodies we really can't see.
Correct.
And it's really key, especially if you have older members of your family, or not necessarily older, that they're looking at your back and they're looking at other parts that maybe, and under your hairline, your scalp.
And the back of your thighs and the back of your calves. Those are not easy places to see, but certainly your back, that's correct, or your scalp. That's very, very right.
And another reason to see your gynecologist annually, because I can tell you a lot of women don't know a thing on their thigh or something that they'll go, I didn't know, has that been there before? I'm like, I don't remember seeing it in the past. It looked different to me. And, I've picked up several skin cancers as a gynecologist, on women's, thighs, because they didn't really look, like you said, on your inner thigh or whatever. But, and sometimes places where the sun don't hit, they can have places. And so we know that sun exposure is a risk factor. What are some of the other risk factors for skin cancer?
It's a very good point. So it's not as simple as sun exposure, right? Sun exposure is the main modifiable risk. It's mostly seen in Northern European, Caucasian descent people. But that doesn't mean it's exclusive to that. African Americans, dark-complected people of any race can develop melanoma in areas where sun is not usually exposed. It's a genetic component in addition to a sun exposure. So risk factors for melanoma or skin cancer, tanning bed exposure, lots of UV exposure, multiple sunburns. Those are things that, make sense. But other things like immunosuppression is a big risk factor. So someone who's had an organ transplant, someone who's HIV, someone who's on chronic chemotherapy, someone who's got rheumatologic disease, who's on, biologic medication.
Right, immunosuppressant
Correct.
drugs.
Those folks need to be evaluated regularly, preferably by a dermatologist, but at minimum by their family doctor, because they are at risk for development of skin cancer. And as you said, we pick up these lesions early. They're very, very treatable and often curable, when found in early stages.
And don't be shy when you go to the doctor. Say, hey, I'm here for one thing, but while I'm here, go ahead and check me.
Sure. That's right.
For sure.
You're already there. You're already paying the copay. Just have to go ahead and check
Get your money's worth. That's right.
Well,
that's right.
So we mentioned when we introduced you that you were the chair of the Skin and Soft Tissue Cancer Multidisciplinary Care Team at the Cancer Center. So tell us a little bit about that team. We have talked about how that is so beneficial to patients at Mary Bird Perkins Arley the Lake Cancer Center.
It's called a multidisciplinary care team, and so this is a group of doctors, other healthcare providers that have a particular interest in skin cancer. And so we meet multiple times throughout the year, every few months. And basically what we do is we look at our practices in our community and in our center, and we compare them to national guidelines and best practices, and we do CME, and we try to enhance what we're doing locally to ensure that what we're offering patients is the best. And in addition, we do outreach. That's the treatment component, but then there's also a big component to spreading awareness and outreach. So it's dual.
Yeah, and we're talking a lot about melanoma because, it's one of the ones that we think about. It's one of the worst, and May is Melanoma and Skin Cancer Awareness Month. But there's lots of other different types of skin cancers.
Definitely.
We won't go into detail on those because we know that, well, we're going to have you back for that.
Sure.
Right?
Sure, let's do it.
That people experience all the time. They end up getting that picked up at their family doctors. They do notice different changes. They get those biopsies, and it's the same thing if it's detected early. It can sometimes be treated with a simple local excision without
Right.
any further long-term treatment
Correct.
or care if it's picked up
Exactly.
early. So if folks are interested, they want to know more information about skin cancer, where should we send them?
marybirdlake.org/skin is a good resource. The Skin Cancer Foundation is another good resource, American Cancer Society, but locally, marybirdlake.org/skin.
Well, so we've been talking with Dr. John Lyons, and thank you so much
My
for
pleasure.
being with
Thank
us.
y'all.
Yes.
We're going to have you back when we talk a little bit about the benefit, Rock
Yeah,
for Spots.
absolutely.
I'm
Yes.
sure that's going to be coming up this summer.
Yes.
And
And hopefully live and in person.
hopefully
So we
live
can all-
and in person.
that's
We know
right.
y'all were virtual.
Yes.
Still did really well
Yeah, it was great.
as a benefit. But we know that folks are really hankering for some live in-person
right.
music, and always like to do that for a good cause as well.
That's right. Well, thank you for coming. We look
you for
forward to you
having me.
coming back. And we'll be right back talking about some good food from City Pork, and we're going to meet the chef. If you haven't met him, you're going to want to. We'll be right back.